Good morning. Good morning. How are y'all doing this morning? I'm a little bit rushed. I was working out and I was doing line dancing and I found a new line dance. And so I started doing the new line dance and ran over a little bit, but I am here. And I am glad you all are here. I want to tell you, if you will please, I'll answer questions as we go along or at the end of the presentation. I'm with you this morning because it's been a while since we've been dealing with coronavirus, and it's been a while since I have spoken to you about what's going on. So I know everybody's kind of suffering from coronavirus fatigue. And so, hi, there's somebody coming from California. I am glad you are here. Darkus, glad you're here. Hey, good morning. I am so glad that you all are here, and I really appreciate you being in with us this morning. But anyway, as I was saying, there's been so much information that we've learned in the last few months. And I thought it was important that we talk about those things so you will know what to do and how to protect yourself. I'm one of these people, if I don't understand something and I, don't know what to do, I have no arsenal to take care of myself, then it makes me very, very uncomfortable. So as we open up, and as we continue to deal with this, it is obvious that it's not going anywhere for a little while. So you got to be ready to kind of, prepare for the long haul. So anyway, I want to give you some stuff this morning. So I'm going to be doing a PowerPoint presentation and talking to you. Do send your comments and all of that. I'm glad to see all of you all. So let's get started. This is your COVID-19 update, and I think it is important that we get that information and we do what we need to do to stay well. So let me start first by saying there's a lot of test confusion. So you guys, if you've been watching the news, you know the CDC will say one thing and then they'll come out and say something different. And then this week there was some documentation that said that some of those things that were coming out from the CDC were not coming from the scientists, that were coming from other sources. So let me kind of help you with the test confusion. You still need to be tested. If you're exposed to somebody and you are worried about whether or not you have coronavirus, you need to be tested. Why do you need to be tested? So you will know what to do. If you are positive, stay at home. We have all heard a number of things where there were people who knew they were positive and they went to family events and that kind of stuff and infected other people. Unfortunately, some people didn't survive. So if you are sick, stay at the house. Stay at home, please. Also, if you test positive, please make sure that you tell the other people that you may have exposed that you tested positive so they can test positive, or they can socially isolate or socially distance, I should say, from other people, so that they won't pass it on to other folks. So our goal for you today is to share with you the updated information. And there are so many of us who don't know what to do. You hear one thing, you hear another, you don't know what to do. Have we learned anything in the last 6 months that can keep you from getting this virus? Yes, we have. So normally what happens is when we have this kind of thing, be it a pandemic or something that's just affecting the United States, or fear of something that is going to be a pandemic, we from the World Organization, CDC, or somebody as physicians, a protocol that we are to follow. So we will know what to tell you. In this case, we haven't gotten that. So a group of physicians who are internists and intensivists and pulmonologists who all over the world have gotten together and put together some data-driven recommendations. And I want to give those to you this morning because they may not ever get to you. And in fact, they may never get to your doctor. So we are going to give you those recommendations to prevent infection in you and your family, recommendations to prevent infection in you and your family, and recommendations for treating yourself if you are at home, and then recommendations so you'll know if you're at home when you need to go to the hospital. I was talking to one of my patients yesterday, and she said, I'm so glad to know that there's some kind of protocol to be able to treat myself if I'm at home, because for a lot of people, what was happening, they were testing positive. They were said, given this, go home, isolate, take some Tylenol if your fever's high, and then if you can't breathe, go to the hospital. Well, what am I supposed to do in between that? I'm going to tell you that. So let me start with this very basic thing, because people continue to ask this question. Is there a difference between SARS-CoV-2 or SARS-CoV-2 and COVID-19? What are those? There's an error on this slide. You see that 9 right there, that extra 9 right here is not supposed to be there. So it's COVID-19. SARS-CoV-2 is the name of the virus. COVID-19 is the name of the illness. So when you see those, they're essentially talking about the same thing. So I want to give you some basic stuff. So if you know what a virus is and you know what your immune system is, when I give you this information on how to stay well, you will know what it means. If there is anybody in your life who's not on this live that you think ought to be on there, send them a call, do something and let them know, particularly if they're a teacher that's going back into the classroom or somebody that's going back to work and they're really concerned, let them know we're on live now. So what is a virus? When I first started doing these, somebody sent me a text and said, are viruses living things? And I answered yes, but the actual answer is not really. So a virus is a submicroscopic infectious agent. Okay, what does that mean? That means that it is a very, very small thing that can cause disease. But this is the kicker that you need to know for viruses. They only replicate in living organisms. So this is the thing that you need to know. A virus cannot live on a surface by itself like a bacteria can. A bacteria, if it's on a surface or it's in the right medium or whatever, so it has food, it can replicate by itself and live forever. A virus can't do that. A virus has to have an organism that it can get into so that it can make copies of itself. It has all the information to make copies of itself, but it does not have the equipment to make copies. Are y'all following me? So it's essentially composed of genetic material that's inside of it and a protein shell on the outside. So this is how viruses infect us, the host. You need to know that. It attaches to the cell, it releases the genetic information into the cell, it takes over the enzymes of the cells, and then it assembles the parts of it, and then you get a new virus, and it breaks out, and those viruses start to circulate throughout your body to make you sick. So I'm gonna give you a picture of this because I know there's a lot of information. Y'all know there's a teacher inside me somewhere. So this is attachment of the virus to the cell. So it attaches, see the little virus sitting up there, this thing here is the cell. Once it attaches, it injects its information into the cell, then it hijacks the cell, replicates the parts of it, then it assembles the parts of it, then it releases it into the body so that this can happen over and over again. Why am I telling you this? Because it is important for you to know that if you can stop the virus at this point, then it is less likely to make you very, very ill. So how do we protect ourselves from viruses? We protect ourselves with the immune system. So y'all have heard immune system all the time. Now there's stuff that's going through your feed when you're on Facebook. Boost your immune system. And you are like, what on earth? So your immune system is necessary to keep you well, but if your immune system is in overdrive, it can also make you sick. So that's what things like lupus is your immune system in overdrive. Stuff like alopecia, your immune system in overdrive. So we know about these things where your immune system is in overdrive, but we also know that our immune system is necessary to keep us well. Y'all doing good so far? Excellent. So let's talk about the immune system, what it is. So when we first encountered this coronavirus, right? When we first encountered it, we said that our immune system had no evidence of it, had never seen it before, so we didn't know what to do with it. And so that's why it was so deadly. So this is what you need to know. Even though your immune system has not seen this before, your immune system has something called innate immunity, and it has adaptive immunity. Innate immunity is that part of your immune system that fights everything. Why do you need to know this? Because if you keep your immune system strong, it does not matter what the virus is or what the bacteria is, your body will be able to fight it out. Does that make sense to you guys? No matter what it is, your body will be able to fight it off. So that you need to know. So there's your innate immune system, and then there's your adaptive immune system. And your adaptive immune system fights off specific things. So after you get exposed to the organism, right, your innate immune system starts to fight it. So you have these cells that are trying to fight it off. Then you have the other cells, parts of your immune system that come in and start to create specific things for that thing that's trying to make you sick. Stay with me. You're going to need this in a minute. So these are the cells in the immune system. There are phagocytes and there are lymphocytes. All of y'all have heard of lymphocytes, you know, in people who have HIV, their lymphocyte count is low, which means they can't fight off a disease. Phagocytes, though, are not something you've heard of. Phagocytes are neutrophils, monocytes, macrophages, and mast cells. Stay with me. These cells actually attack something that comes in your body. So it may actually engulf the organism and gobble it up. And it sends out these chemicals called cytokines, means chemicals, to have other cells to come in and participate in the fight. So you have those two kinds of immunity. You have your innate immunity and you have your adaptive immunity. There's other immunity that we can have. For instance, there's passive immunity. That's what mothers give to their children when they're breastfeeding. And then there's immunization-induced immunity that we get from vaccines. Okay? So I just wanted you to know that. Now let's specifically get to COVID-19. Now, what I'm about to tell you is information that we have learned in the past 6 months. We now know that this virus is airborne. At first they said it's not airborne, it can be aerosolized, but it's not really airborne. So the difference in it can be aerosolized and it's not really airborne is this. Aerosolized means if I cough or sneeze, I put it out there, but in a few minutes it drops out of the air. If it is airborne, that means I cough it out or talk it out and it's out there, but it circulates for a while. So that's why being in a room with a lot of people that's putting out air, talking loud, any of that kind of stuff is really dangerous. So that's why going to a bar is dangerous. That's why, you know, being somewhere with a lot of people that don't have on masks and they're loud and they're laughing and they're talking or singing, that is really a problem. Then we know that it predominantly affects the respiratory system. So that means your lungs. So again, I put out I did a Facebook Live a while ago where we were talking about masks, and I see so many people still who don't have their noses covered. You are not effectively protecting yourself if you don't cover your nose, your mouth, and now your eyes. So there was a study that came out this week that said they think that people who have glasses on have some protection for their eyes, but they are still recommending that if you're going to be in an environment, so for instance, if you're going to be on an airplane, I recommend if you're going to be on an airplane that you have a face shield or you have goggles or something to protect your eyes as well. Goggles without your glasses, face shield with your glasses. We know that this is a predominantly inflammatory disease. So I'm going to show you a slide in a few minutes to show what parts, when the virus is really active and when you have to worry about it. The other thing is it affects all ages. Why do you need to know that? Because remember, initially they were saying that children don't really get sick and young people don't get sick, but it just affects older people. Now we know that it affects everybody. And while it is still rare for young people to succumb to this disease, young people die too. So this is not a joke. You want your babies to know this is not a joke. Just wear a virus. And there's also some long-term sequelae. Now, sequelae is a medical term, which means there's some stuff that could happen to your body long-term after you think that you're over this virus, but you could have some long-term effects. So what do we know 6 months later? What does this coronavirus cause? It causes hyperinflation. So we've been talking about inflammation in our bodies for a long time. Anybody who has followed me, we know that we talk about inflammation. It's real important to talk about inflammation because many of the things that we suffer, everything from heart attacks to strokes, all of those things are because of inflammation in our body. This coronavirus or COVID-19 causes hyperinflation in your body. So you are inflamed from head to toe. And that hyperinflated state is called a cytokine storm. We know that it dysregulates the immune system. So the immune system starts to fight it, and then the immune system goes into overdrive, and that's a problem. It also causes something called hypercoagulability. I know that means increased clotting. So you've heard people talking about people having strokes just from coronavirus. It is because it causes the blood to clot too much. Why am I telling you this? Because if you know that this happens, then when I tell you what the recommendations are, you understand why you need to do what you need to do. It also causes hypoxemia or low oxygen. And that's why people, initially, there were so many people getting put on a ventilator because their lungs were not functioning well and they could not oxygenate their blood well. If you cannot oxygenate your blood well, you do not survive. So look at this slide, take a minute, look at it. I know it's a lot of stuff, but I want you to follow one part of it. So see this green line right here, which is the viral replication line. See that line? Okay, that's important for you to see. So look down here, look, these are the days of infection, day 1, 5, 12, 15. See this viral replication line? There are essentially 2 phases of this illness. The first is the viral phase, and the second is the inflammatory phase, okay? So this first part is when the virus is replicating. Look at how long it replicates. After about 2 weeks, the virus is not replicating anymore. So remember back there where I showed you what that replication looks like? It's not replicating anymore. So the antiviral. So remember they had all of the conversation about hydroxychloroquine and some of the other antiviral medicines. And so the intensivists were saying, the people in the hospital were saying, this does not work. And some people were saying, yes, it does work. The way that medicine works is by stopping the replication of the virus. So if the virus stops replicating at about day 14 or 15, the reason it doesn't work later in the disease is because the virus is already dead. Does this make sense to y'all? So it may work in the beginning, but it doesn't work near the end. Okay. So the other thing I want you to look at as this first phase is the viral phase. And that's when you are at the house and you got the cough and the sore throat and the nose, and then you may have some issues that are going on with your GI tract and those kind of things. So you may have some diarrhea or something like that. That's important. And then about day 12 or 11, you start to have breathing problems. That's important to know because now you have started to have involvement in your lungs, and this is when you need to seek medical care if you start to have that issue and you see this oxygen saturation starts to fall and go downhill. When you start to get here, you are really, really in trouble. So this is information that I think is important for you to know. So the viral phase is the first 5 days. Most people or many people are asymptomatic at the very beginning. So asymptomatic means you've got the virus, you don't even know you have the virus. That's why everybody has to act as though they do. This viral phase peaks at about 5 days. So at about 5 days, if you are going to have symptoms, they start then. This is the time that the antiviral medications would be effective. So during this time, this viral phase, the first 10, 12, 14 days is when we are targeting stopping this virus from replicating so you don't get to the viral storm. Is this making sense for y'all? So the second phase that I just showed you is that inflammatory phase. So in the second phase, if you get an antiviral, it won't work. So if you're in the hospital and you're getting an antiviral medication, it's not going to make you better because the virus is already dead. So what is happening in your body at this point is that you are dealing with inflammation. And so at this point, the treatment should be targeted at inflammation. So these are the protocols. Are y'all ready? Take a picture of this, write this down. What this means is they've looked at, so in the last 6 months, there has been a whole bunch of information gathered all over the world, everything from Europe to China to the US, and all of these doctors put their information together. There have been papers written, all of this, and this is what they find helps people not to get the disease. So this is what you do. If you're a teacher, you're having to go back to school. If you are somebody in a workplace, anybody, this is the stuff that you need to take. And these are the dosages that you need to take them now. I am not telling you what to do. I am giving you the protocol. So I am not giving you a prescription. I am giving you the protocol so you know what the data says that you need to do. The first thing is you need your mask. A mask is more effective than a vaccine. Most vaccines are about 70 to sometimes 40 to 70% effective. The mask, if I'm masked and you're masked and we're together and we are physically distanced, we take that thing down to about 90% protected. So a mask, you need a mask. Physical distancing is important. The reason I don't say socially distancing is because I am seeing people who are really suffering from social distancing, which means they are at home by themselves and out of sight, out of mind. If folk are not seeing you, they're not even checking on you. So physical distance, not socially distance, and hand washing. Wash your hands, wash your hands, wash your hands, wash your hands. If you're traveling through an airport, wash your hands. If so essentially, if you see a sink and some soap, wash your hands. The other thing that they've recommended is melatonin. So melatonin, the data indicates that people who take melatonin don't get this disease as often as folk who don't. And if they get it, they are not as sick. Vitamin D, we have talked about vitamin D. The recommendation is somewhere between 2,000 and 5,000 international units a day. But when you get your vitamin D level checked, If it is lower, then you need more. I recommend for most people, particularly if you have melanin in your skin and you are brown skinned, then most of us need about 5,000 international units of vitamin D. Vitamin C, you should take vitamin C every day, at least 500 milligrams twice a day of vitamin C. This is what the data indicates. They are even giving people in the ICU in this protocol IV vitamin C. They call it ascorbic acid. That's vitamin C. So take your vitamin C. I know it's all back and forth. No, does it make a difference? Yes, it makes a difference. We now see, not specifically for coronavirus. So some of this is specifically for coronavirus, that they've looked at the papers and said people who give vitamin C, they do better. But you will see this stuff online, and you will hear people, particularly in the media, say, well, we don't know about coronavirus. There's no treatment. We don't know what you can do to keep from getting coronavirus. Listen, we know what you can do to keep from getting viruses. So you need your immune system working optimally against virus. This virus doesn't attach any differently than any other virus is attached. This virus doesn't infect your body any differently than any other virus affects it. Be the flu, be a cold, be HIV, be anything. It's not any different. So when you are doing this to prevent it, you are preventing that for all viruses. So you need your vitamin C, and you also need quercetin, and I'll talk to you about that later. The data indicates that if you take 250 to 500 milligrams twice a day, you take that with your vitamin C and your zinc. Zinc lozenges are preferred. The reason zinc lozenges are preferred is because of the way you absorb those lozenges. And they are saying that you start initially with about 50 milligrams a day, and then after a month, you can go down lower. Then for prevention, here are some things that are optional. Famotidine, that's Pepcid. And the reason they are recommending Pepcid, or they have seen that Pepcid is effective, there are some people that the first sign of this illness is diarrhea. Well, why is it diarrhea? Because you have inflammation in your gut. And if you take Pepcid, it will help with that inflammation. Then there's interferon nasal spray. Interferon is one of the things that your immune system produces. You'd have to get the interferon nasal spray from a doctor. And then ivermectin is one of those anti-malarial drugs like hydroxychloroquine and chloroquine. It pops up again, that if you get exposed and you know you're exposed, that's something you may want to talk to your doctor about. So why is mask wearing and hand washing so important? Because it decreases your viral load. So let me tell you what that means. That means if I'm in the room with you and you have the virus, if I've got my mask on and you don't have yours, I'm breathing in the air. Some of those particles are going to get stopped. So I'm not taking in a whole bunch of it. I'm taking in a little bit of it. And if I take in a little bit of it, I am much more likely to be able to kill it before it kills me. Does that make sense? Same thing about hand washing. If there is virus all over everywhere and I'm touching it, if I wash my hands, I'm less likely to get much of it on my face and that kind of thing. So I decrease my viral load. Now, when we first start talking about masks, I remember we had a conversation. Somebody asked me, do you need to have your mask on in the car? And I said, no, you don't have to have it on in the car, but there's a caveat to that. If you're riding in a car with somebody you don't live with, and you don't know whether or not they haven't been tested, and even if they've been tested, if you all are in the car together, if you can imagine, a car is a closed environment, you are breathing the same air, yes, y'all need a mask, because you can really increase your risk of contracting the virus if you are in close proximity to somebody like a car for an extended period of time. And so that goes for young people who are riding to college together. That goes for folk who are living together. I recommend as much testing as possible. Okay, so the reason you do that is to decrease your viral load. Now, this is why they're recommending melatonin. First of all, whenever we are sick, our melatonin levels decrease. And so as we age, our melatonin levels decrease. Melatonin is a powerful antioxidant. That means when there's damage to a cell or something going on, melatonin is great for repairing that. It also helps to mitigate stress. It also helps to optimize the immune response. So melatonin helps your immune system to fight better. Remember those cells that I told you, macrophages, all of that stuff? Melatonin helps them to work better. The other thing that melatonin does is helps your body to make ATP, which is power for your body. So if your body is powered up, it's more likely to be able to fight disease. Why do you need vitamin D? Vitamin D is uber important because vitamin D enhances the function of the T cells and the macrophages. Remember those things that gobble up the virus. It also decreases, or low levels have been associated with increased susceptibility to infections. So just having low levels of vitamin D increases your risk of infection, particularly respiratory infections. So that means colds, that means the flu, that means viruses, including coronavirus. So not only does vitamin D help you to fight off an infection, on the other end, vitamin D keeps your body from overreacting. So it keeps your immune system from overreacting so much that it ends up damaging your body. Y'all following me? Then the reason you need quercetin, vitamin C, and zinc is because those things stop the replication of the virus. So remember when I showed you way back when at the beginning of this talk that there's a replication phase and then there's an inflammatory phase. Remember, if you can stop that replicatory phase, if you are taking your vitamin D, your C, your zinc, your quercetin, that inhibits the replication of the virus. So not only does it help kill the virus, but it keeps your viral load from getting too high because you have killed it. Are y'all following me? So this doesn't have to be specific for coronavirus, but it is. And you see that there are studies that show that in vitro, that means in the test tube, that zinc inhibits this RNA-dependent polymerase, means that zinc inhibits the replication of this virus. Okay? So that's important for you to know. Okay, so those are the things that you need to take if you're trying to prevent the virus. Let's go back to this slide, take a picture of that, do whatever you need. This is the stuff that you need. You need a mask, you need physical distancing, we know that already, hand washing, but melatonin, vitamin D, vitamin C, and zinc, and quercetin. Those things you need. Okay, now let's go forward to if you are sick and at the house. So let's say you have gone and they have told you you have coronavirus. The first thing you need to know is just because somebody says you have coronavirus does not mean you are going to die. Your thought process about this matters. But also you need to know what to do to try to stop this from being overwhelming to your system. So the sick protocol at the beginning is the same as the preventive protocol. So I had one of my patients who got coronavirus, and I was checking on her every day because I was concerned about her. First of all, she was scared. Second of all, I wanted to know she was okay so I could kind of tell her what to do and to monitor her to know, if she needed to come into the hospital or whatever. And I asked her, are you still taking your vitamin D? She said, oh, no, Dr. Wayne, I stopped. Don't stop taking your vitamin D. Take your vitamin D. Do not listen to the noise. We do not have to have a whole bunch of drugs to fight this or any other virus. I'm not there's a place for drugs, but if you can treat yourself effectively, most people survive this virus and do well. So if you are sick and you have been diagnosed with coronavirus, you do the same things. You mask, you physically distance, you keep your hands washed, you know, your family doesn't need to be close to you, you do your melatonin. They say the recommendation, if you are ill, that you may go up to as much as 6 milligrams on the melatonin. You take your vitamin D, just like you were doing here, 5,000 international units. You do your vitamin C twice a day. You do your zinc. These are the things that you add if you have the virus. One is an aspirin a day, unless it is contraindicated. So if you're one of those people who it's not safe to take an aspirin, don't take it. But if you're a person who has started an aspirin a day, why do you take an aspirin a day? Remember, we talked about it increases the clotting of your blood. If you take an aspirin a day, then it keeps that from happening. The other thing, remember on the preventive protocol, the famotidine or Pepcid was optional. If you are sick, you need to take the Pepcid. Why do you take the Pepcid? Because that helps the inflammation in your gut. And then the other thing you need is a pulse oximeter. And I meant to have my pulse oximeter. I'm going to send my team. Y'all know my team is my daughter. To get the pulse oximeter for you. A pulse oximeter is a way of testing your oxygen. Okay, so the reason you want to test your oxygen is if you start to get in trouble and your oxygen level starts to go down, then you know you need to go to the hospital, because what you're doing at home is not enough to do what it needs to do. Okay, so she's going to bring that to me in a few minutes, and I'll show you what that is. So let me see if I can answer a few questions. So thank you for sharing. Thank y'all so much. Here's somebody, Carolyn, says, thank you for sharing this information. I get a lot of thank yous on here. Thank y'all so much. Jessica says, this great information. Kathy, thank you, Kathy. She says, this is good. Is this helping y'all? Is it? What I wanted to do was make sure that I gave you this information so that you wouldn't be at home scared. You know, okay, now I know what I can do. I need my vitamin C, I need my vitamin D, I need my quercetin, I need all these things. Okay, can y'all see that? That's a pulse oximeter. You can get it on Amazon, pulse oximeter. What it does is takes your oxygen in your blood. So you would put your finger in and you use your index finger or your middle finger. So what you want to do with the pulse oximeter, before you do your blood, you want to warm up your fingertips before you check it, because you want to make sure that you're getting good blood flow. So order these. You need this at home. You need a thermometer at home, pulse oximeter, thermometer. Okay, so you do your pulse oximetry if you are sick, and you watch your O2 sat. If your oxygen saturation, so normal oxygen saturation, y'all write this down. Normal oxygen saturation is in the high 90s. So it ought to be higher than 95. If it starts to fall below 94, unless you have baseline lung disease, that's a problem. And if you have baseline lung disease, it really is a problem. So if you you got coronavirus and you're at the house and you start to be short of breath and you do this O2 sat, okay, now mine is 98. Can y'all see that? No, you probably can't. Anyway, y'all know these cameras flip. I have you upside down. Anyway, you ought to be in the high 90s. If your O2 saturation starts to fall, then you need to go to the hospital. So don't be waiting another 2 or 3 days. One of the reasons a lot of people don't survive, not a lot of people, but many people don't survive, because they're at the house when they ought to go to the hospital. Because initially we said, don't just go to the hospital if you think that you got coronavirus. What we meant was everybody who has a runny nose or a cough, don't go, because you'll expose other people unnecessarily. But what we did was we scared people from going to the hospital. And now people are staying at home with heart attacks. They're staying at home when they can't breathe with coronavirus, and then they're not surviving this thing. Okay, so that's really important to know. So get you a pulse oximeter, get you, and I'll hold it up again so you can see it. It's just this little thing. Get you a pulse oximeter, get you a thermometer so you can have at your house and so you can know what to do. Okay. So I'm going to answer some more questions for you guys in just a minute. So here you go. So somebody in the stream asked about vitamins. You know, I have a line of vitamins. It's called Well Aware. And if you go to our website, it's askdrjill.net. askdrjill.net/supplements. You can see some of these. We have vitamin D plus K2. We have a multivitamin that has your zinc and some of those other things in it. I'm offering an immune support. That immune support has your D, and it also has some herbal supplements. It's got elderberry and those kind of things. We've talked about that before, that helps you fight this disease. It also has Ultimate Nutrition, which is chlorella, which is like a super green that's good for everybody. I had a patient, had somebody call my office this week and ask my staff what other things that I recommend just for general health. And I recommend for everybody this Ultimate Nutrition and a multivitamin. And then there are a lot of people who are having issues with sleep and anxiety. We've got a sleep support and anxiety support as well. So go to the website so that you can look at those. Yes. Am I good, y'all? Half of my face was out. That's what my staff said. Okay, so here you are. So these are some final points that I think are really important, and then we'll get to some of your questions. This is a manageable disease. If you get diagnosed with coronavirus, the reason I wanted you to know how to treat yourself and what the data is indicating, because now you are at home, not just taking some Imodium or something for your diarrhea, you are taking some Pepcid so that you can stop the inflammation in your gut. You are not just at the house taking some Tylenol. You are at the house taking some vitamin C and some vitamin D and some quercetin and some zinc so that you can stop this virus from replicating. The one thing we have learned through this pandemic is that we are responsible for our own health and well-being. Knowledge is power. Pass this on. If your kids have to go to school, give your baby some vitamin D and some vitamin C. Change their mask every day. Wash those masks so you can get that viral load that's on there off. This is not about to go away in the immediate future. It's going to be a while. So we are going to have to be able to resume some semblance of normalcy. If you know how to keep yourself safe, you are much more likely to be able to do that. Testing is important. Don't believe the hype. Testing is important. If you have been exposed to somebody, and as a matter of fact, the CDC came back out yesterday, because a few weeks ago, they said you don't have to test if you've been exposed. Now they came out yesterday and said, yes, you do. So you need to test if you've been exposed so you'll know what you're dealing with. Then the other thing is be creative and figure out ways to stay safely connected. So I was talking to a patient yesterday, and she's online. Hey, patient, yesterday, you know who you are. And I was saying, because I also see one of her parents, and I was telling her how her parent has been affected, and she knew that already, with the loneliness and being separated. And so I said to her, listen, you can go and see your parent, wear a mask, y'all physically distance. So if you got a big front porch, go sit on the front porch. Sit on the ends of the driveway. Meet your friends, but social. You've got to be able to socially distance. Then at some point, we need to be able to touch each other. So we need human touch. So I'm hugging the folk in my house. I'm hugging the people in my pod. If your mom is at home, your parent is at home, test yourself. Make sure that you are negative and you have no symptoms and all of that. Wear your mask, clean clothes, whatever. Don't go to the grocery store and then go to mama and give mama a hug. It's not going to be a 15-minute hug. It's just going to be a little bit of hug, but she needs that hug. We've got to be creative in figuring out how we are going to stay safe. So y'all good? Okay, good deal. Now I got to figure out how to get out of here because that's the end of my side. I got it, baby. Okay, here we go. I am ready. So somebody said, currently I'm taking probiotics. I ordered for yourself for a healthy gut. Do I take the immune support vitamins and Yes. So probiotics are important because what did we tell y'all? Most of your immune system is in your gut. And so your gut needs to be healthy. That's where you're making a lot of these cells that we're talking about. They are being made in your gut. So yes, gut health is very, very important. Okay. If I don't catch them, scroll up. My daughter says scroll up. And I'm using her mouse, y'all. So it's really, okay, so let's start at the top. Oh my goodness, so many of y'all. Y'all are so welcome, so welcome. Pass this information on so you can know what you need to do. Now, there are some people too who've had coronavirus. And they're positive for antibodies. There's some people who were diagnosed with coronavirus and now they're having the sequelae afterwards. So they're still tired, they're still running fever and that kind of stuff. They also talk about this in this protocol, and they recommend that you have a C-reactive protein done, you have antibodies done. If your C-reactive protein is elevated, then you may need a statin. You do need to take an aspirin every day, and then you need to take these other things. And for some people, they need to have steroids. So talk to your doctor. If your doctor is not aware of this protocol, the protocol is called the MATH Plus protocol. That's real important to know. Okay, here we go. Do I see any questions? I have a mom with weak lungs and a dad who's bedridden with a stroke. That she cares for. I can't see, let me see the rest of, if the rest of this can come up. Do you see it? So if you are caring for somebody, listen, if you have somebody in a nursing facility who lives in a senior facility, take them some vitamin D and vitamin C and stuff because they need to be able to be well as well. This helps me equipping people to take care of the fear away. That, and thank you, Christy. That was so important for me. If you're not scared, if you got some power and you know what to do, then you're not scared. And you know when to seek help and you know what to do. If your baby is sick, you know what to do. This is powerful, powerful information. Somebody says power or liquid vitamins better than tablets. It depends on whether you absorb them or not. So if you're one of those people and you take a vitamin and then you poop it out and it's still whole, then you probably need to get some liquids until you get your gut in better condition so that it can absorb those vitamins. Also having high copper level in the blood, that was somebody had ramifications on the immune system. Somebody says this is definitely a big health. That's Kathy. Hey, Kathy. Very useful information for me and the family. Knowledge keeps us safe and healthy, and it does. And particularly your young people. So listen, you might not be able to get your young people to take a whole bunch of stuff, but you can get them to do one emergency a day. So you get some emergency and say, put this in a bottle of water once a day. It's pretty, it tastes pretty good. They get a lot of vitamin C. They don't get any vitamin D. So if you can get them an emergency and a vitamin D, then that's going to help your babies, and they'll put something in water. I've been having issues lately with headaches since I've gotten over it. Some people continue to have headaches. Again, that's your that's that inflammatory part of your immune system. So the other thing that you need to know that helps for inflammation, period, what you eat matters. And I mean, what you eat matters. So if you are fighting off this or any other illness, you've got to get your body powered up. Fruits and vegetables are powerful. All of those immune cells that I told you about, all of those are optimized with the phytochemicals and phytonutrients and things that are in fruits and vegetables. So do fruits and vegetables. Come on, y'all. Y'all have been watching me a long time, you know.
I'll give you some of the questions.
Okay, give them to me.
Is it necessary to wear a mask outside when you're walking as a workout?
Is it necessary to wear a mask? My daughter took over the question. She said, I'm missing too many, y'all. Isn't it funny when your children start telling you what to do? Okay, so she said, somebody asked, is it necessary to wear a mask when you're walking outside? No, if it's just you. Or you can safely stay away from people. So I went to the park recently. Mostly I work out at home, but I went to the park recently, and this is what I did. I had my mask hung over my ear, and when I was approaching a group of people, I put my mask on and got past them. Particularly if they're laughing and talking, it's like y'all are putting out air. But for the most part, you're okay. I would just have it with me in case I encountered a group of people or something like that that I couldn't get away from. Next question.
Is high zinc blood level an issue with taking zinc? Is it counterproductive to fighting COVID?
No, you need to take zinc. So a high zinc blood level. So that must be something different. If your zinc is too high, then that's a medical issue. You address that with your physician. But you need at least 20 to 40 milligrams of zinc every day to help your immune system stop the replication of the virus in the event you should encounter it.
How much vitamin D should we take per day/week, and what is the K2 in vitamin D?
The K2 in vitamin D. So the first part of that question was how much vitamin D. The recommendation is 2,000 to 4,000 international units daily. However, hi, Dr. Paula. I see Dr. Paula Dobbs-Wiggins on there. And there's Amber, who's my assistant. Hey, y'all. Okay, anyway, I got distracted. She's going to turn my comments off. Okay, no, I'll have to say hi because I appreciate y'all watching and getting the information. So anyway, ask the question again.
How much vitamin D?
Okay, how much vitamin D? 2,000 to 4,000 international units of vitamin D3 daily. But get your level checked. And if you are low, then you need to maybe add more. Most people who have melanin in their skin and we block the sun's rays, or we're not getting a lot of sun's rays, we will be extremely low. So you need about 5,000 international units a day. If you have a prescription for vitamin D, it's usually vitamin D2, and it's 50,000 international units once a week. Be careful taking more than 5,000 international units daily because vitamin D is a fat-soluble vitamin, so you can get too much of it.
What is the K2?
The K2 with the vitamin D. So vitamin D helps your body to lay down calcium. Okay, so it helps you to put calcium in your bones, but it also, D will start, if you get higher dosages, you'll start to lay down calcium in your soft tissue. If you take K2 with that prevents it. That will keep you from laying down calcium in your arteries and causing problems. So that's why you add the K2 to it.
So I'm going to ask you two questions at once.
Okay.
Someone said, if you have someone in your house test positive and you can isolate them, what is the proper length of time everyone else in the house should quarantine, and from what day? Also, if you did test positive and you've had it for 14 days, after the 14 days, is it safe to go out?
Okay, that's a great question. So I don't know if y'all can hear the question, but it essentially said, how many days do you need to isolate? So a safe period of time is from the first day you have symptoms, 14 days after that, you should no longer be replicating the virus. So remember I showed you that the graph where you could see when the virus was replicating, Okay, so after about 14 days, you are not making virus anymore. So one of the reasons that the CDC said we don't need a test negative after 14 days, at first it was like you couldn't go back to work unless you had 2 negative tests. Because even though the virus is dead, the test may still be positive because we are testing for parts of the virus. Y'all follow me? So after 14 days, even if you still test positive, you are not likely to be infectious. So 14 days from onset of symptoms, then you should be okay and you should not be contagious anymore. I hope that answers that question.
If you are negative to COVID and your partner is also negative, but you live separately, can you be intimate?
I think so. You need that to kind of help you. So listen, this is what you need to do. You have to both be honest. And if you're doing everything you can, so you tested negative, y'all are doing what you need to do, and you are, wearing your mask and social distancing and taking your supplements and all of that, you should be okay.
Can you send the presentation out?
So y'all, I will post this presentation on my website. Okay. Not only will I post it on my website, but I will also post for you the references from this Math 1 or Math Pro Plus protocol. Okay. So I will post this on my website. Give us 2 days. So by Monday, it should be up.
Yes.
By Monday, it will be on there. And I'm going to give you the references because some of you in here are scientists and physicians, and you may want this reference. It's the Math Plus protocol put together by doctors, by a group of physicians who are intensivists, pulmonologists, internal medicine docs who have been treating COVID all over the world. There is about 5 pages of references because I know y'all need references. And so we will post it on the website so that you can have access to this information because you need it too. Because if you are a doctor, and particularly a brown one, everybody is coming to you for information. It doesn't care. If you're a radiologist, they are saying, Mama got COVID or ain't so-and-so here. What do we need to do? And so they are going to kind of ask you for guidance, and this is a good source for you.
How much is a good dose of vitamin C and vitamin D for school age children?
Very good question. So little people, 400 international units of vitamin D, and they can do 250 of vitamin C. So you can do that on your little people. Somebody asked about school-age children, and that's usually about the amount that's available. If they get sick, you can double up a little bit. Be careful. You can't double up on vitamin D because remember I told you it was fat soluble. Vitamin C, you can give them a little more of, but I would recommend in your little people, you do the vitamin C supplement, then give them an orange and, some of the vitamin C containing foods to kind of boost them as well. So you want to put some of that in their lunch every day.
Are the vitamin C gummies okay for kids?
Yes, vitamin C gummies are okay for kids.
She said she didn't quite get the answer to the question, so I'm going to pose it again.
Okay.
In the house with someone that tests positive, are they to quarantine the same 14 days, or should it be 14 days after their 14 days?
No, 14 days. If somebody in the house tests positive, 14 days should be adequate for isolation in the house.
So everybody in the house should isolate for 14 days. Quarantine for 14 days.
If everybody else tests negative, they should be okay. But if you can isolate, then yes, isolate. So, and I know this is a complex question. So the question is, if somebody in the house tests positive, but everybody else tests negative.
Yes.
Okay. So the person in the house who's positive should definitely isolate from the rest of the household. Okay. And the whole household should probably isolate from outside people because some people may turn positive later. Does that answer the question? I hope so. Okay.
Is it okay to take vitamin D and D3? And if I take vitamin D, can I take vitamin D and vitamin DK2?
No, that's too much. Okay, y'all, don't do too much. You need 5,000 international units total of vitamin D3 a day. So don't take the D3 and K2 and some more D and some. No, you need 5,000 international units total a day.
Is a scratchy throat like something is in it a COVID symptom?
Sore throat can be a COVID symptom. So I know y'all gonna be tickled because yesterday I was thinking, oh Lord, everybody, you have a little something, you think, oh Jesus, it's a coronavirus. And so I got up and took me some extra vitamin C. But it can be a symptom. But so if you're in the Dallas area, now ragweed is really, really high. So y'all, it's much more likely to be ragweed than corona, but I'm with you. So that's why you wear your mask. And, if somebody coughs in my household, I will mask them up in a minute. Why are you coughing? Where have you been? So you do, you want to pay attention. You take your supplements and so forth. Any symptom that continues for a few days, of course, you want to check it out if you can.
Should we be wearing masks and eye coverings? And then the second question is coworkers walking around in the workplace maskless and talking.
That's a problem.
Is spraying Lysol in the air a good preventative measure?
Well, you can spray Lysol, but if you're spraying it in the air and you're inhaling Lysol all day, then that's a problem. So I'm gonna tell y'all, I went and took myself to lunch, and we were, folk were way away. Probably the tables were 10 or 12 feet away. But I have an essential oil hand sanitizer, that has essential oils and stuff in it. And so there was a group of ladies who were particularly loud. It was just two of them, but they made a whole lot of noise, which meant that they were projecting their voices. They were far from me. I took my sanitizer and shoot around my head just to make sure. And then I put my mask on in between. So yes, you can spray with Lysol. I wouldn't spray all day. And if you're in the workplace, I don't understand why you can't go to a supervisory person and say, listen, they're not wearing their mask, because that is risk for the whole work environment. And I know the company don't want all of y'all sick. So I think you should say something if people are not wearing their mask. Hey, Nisi, that's my little cousin. Okay.
Can you give the guidance on taking vitamin D again if someone has normal vitamin D levels, and then is vitamin D 5,000 units enough?
Okay, so vitamin D, this is the question about vitamin D. Blood ranges for vitamin D should be between 30 and 100. Optimal range is between 50 and 80. So let's say you get your vitamin D taken and it's 30. That's in the normal range, but that's not optimal. So you need it to be up at least 50. So if it's 30, you need to take 2,000 international units. For every 10 points, you need to elevate your vitamin D. Pay attention. You need 1,000 international units daily. So to move your vitamin D from 30 to 40, you need 1,000 international units. To move your vitamin D from 30 to 50, you need 2,000 international units a day. Y'all follow me? So that's how you determine how much you take. The other thing, I had a family member who went to the doctor recently for blood work, and they didn't do vitamin D. Ask for vitamin D. You need to know what your vitamin D level is. Even if you have to pay for it yourself, you need your vitamin D level. Okay, so we've gone for a while, you guys. We're an hour. I'll take a few more questions.
Can you do mask and eye coverings? Should we do mask and eye coverings?
Yes, that's good. Should you do mask and eye covering? Yes, you should do mask and eye covering. And I will say this again. Go back and look at the thing I did on mask. It's on Facebook Live and Instagram, I think. Everybody's doing those shields. And they're doing their shields. I see them in the store all the time. Some clerk has on a shield and no mask. you need a mask with that shield. A shield is eye covering. It is not a mask. So you've got to cover what? Your nose, your mouth, and your eyes. So if you have on glasses, it depends. If you're in an environment where you're close in with people, then even though you have on glasses, you need a shield. So I wear a shield every day when I'm seeing patients. If you're on an airplane, you need a shield or some goggles or something in addition to your mask.
Okay.
So there you go.
Autoimmune disorder and vitamin C. Is it okay to take vitamin C if you have autoimmune disorder?
I would ask my doctor about that specifically. So if you have any issues medically, then talk to your doctor about them. Ask them specifically. So I want to take these supplements. Are there any contraindications to me taking these supplements with the medications that I take? And if you have a good relationship with your pharmacist, that's a good thing to do as well. That's why I recommend that you go to a small pharmacy, because you need to be able to have a relationship with your pharmacist. And there are several small pharmacies in the area. Shout out to the ladies that are over in DeSoto with their pharmacy, in the Health First Pharmacy. Health First Pharmacy, they are great over there. But get you a small pharmacy so the pharmacist can ask. You can ask them questions as well for contraindications.
Are glasses with your mask sufficient in terms of eye covering, and are shields reusable?
Shields are reusable. And yes, for most people, just for every day, as you are going around and doing your everyday things, glasses and a mask are sufficient.
What if you don't wear glasses?
Then you really should consider some kind of something, some glasses or some goggles, particularly if you run the risk of being close to people. And I know nobody wants to look like they're getting ready to go on a spaceship, but y'all, we try not to get corona.
I believe that's all of our questions.
Okay.
If there are any that we have not answered, we will try to go back in the comment section and comment back to those. But we will get the PowerPoint posted on the website
by Monday. So PowerPoint will be posted by Monday. And look, guys, I'm about to start a podcast. I will let you know when the podcast starts so you guys can go on and subscribe so it can drop directly to you. There's so much information I like to get to you because my goal is to take the mystery out of medicine. My goal is to keep you empowered. My goal is to give you the tools that you need to take care of yourself to stay well. We all have things to do. We have purpose. It is nobody else's responsibility to take care of you but you. And so you got to know what to do. I appreciate you taking time out of your life and out of your day to listen to what I have to get to you. My husband will really, really be glad that I finished with this, because anytime I am preparing for one of these, he has to listen to the information for days and days and days. Yes.
One last thing.
One last question.
My pharmacist doesn't wear a mask. Should I be concerned?
Yeah, you should be concerned. You should be concerned with anybody that's not wearing a mask. And I put on a mask, y'all. What? It's 2 pieces of elastic around your ears. This is not political. This is about us saving our lives. If we all wore a mask, we could shut this thing down. What did I tell you? That a virus has to have somebody to be infected for it to continue to live. And so if it has nobody to replicate itself, then it can't be passed on. It's just really, really simple. I keep saying that God has the world in timeout. And if we would just listen, we could all get out of timeout. Okay, enough. I love y'all. I appreciate y'all. I see all of the thank yous, and I am so appreciative. And just pass this on to other people. Make sure you follow me on Facebook, Instagram, Twitter. Go to the website. You can get the information and you can look at those supplements and see what you can order. So I love y'all. Have an amazing Saturday. Blessings.